Good morning, and thank you very much for joining us. I am Iyori Folani. Hope you're doing your best to stay safe. It's all about staying at home as much as you can, and of course, the whole matter of effective social distancing. As always, these days, I'm alongside my colleague Cyril Abaku. I'm lucky to have I vary them from time to time. Today, I got Cyril. Cyril is our research guy. Thank you very much, as always, for making the time, Cyril.
Very good morning.
Really, let's look at where we are. Let's go back to the briefing we got yesterday from the Presidential Task Force, and Ivy Kano has a report on that. That will just sort of situate us, and we'll come back and we'll take on other aspects.
It is the usual daily briefing by the task force team. This time, there are some pleasant news. The federal government is reviewing its procedure of providing support to citizens who bear the brunt of the lockdown. The Ministry of Environment says it is set to disinfect and decontaminate over 100 aircraft.
So we're using the BVN, so the bank accounts, as well as mobile phone networks.
We have mapped out 125 aircraft and 13 airports across the country for decontamination and disinfection.
Closure of the country's airspace was extended by 2 weeks, but there seem to be steady activities at some major airports. Enforcing the wearing of face masks as planned by some states was not ignored. The relevant ministers threw more light.
Every single flight that you would see, every single one that we would approve would be an essential flight. 98% of them will be connected to COVID-19. A few of them, maybe 1%, might be either repatriation, medical evacuation.
The improvised cloth mask will suffice at community level. And in this regard, we advise you do not use nylon material or polyester material.
The Ministry of Education is concerned about many children not being educated as a result of the lockdown, and the task force has an eye on some emerging delicate situations.
From the national here, every resource we have is available to everybody. Our biggest challenge is to reach children who do not have devices and who are the fringes of our communities.
We are closely monitoring Kano, Oshun, Oyo, and Edo. We note the particular concern with Kano, and we have engaged closely with the state government.
The task force is not unmindful of the huge tasks ahead, but remains optimistic that at the end of it all, the lessons thereof will not be lost.
Where some agencies that are directly under the ministry had produced walk-through disinfection process and also some ventilators.
So far, not less than 20% of infected cases have recovered. This serves as a source of hope to the team that all efforts are not in vain. Ivy Kano, TVC News, Lagos.
Reports of mass burial.
As always, thanks to Ivy Kano and a whole team of her colleagues doing a great job in these difficult times of bringing it to us. That report, of course, went out before now. That wasn't the first time it went out. So here we are, Cyril. What do you think?
I think this is good news coming to Nigerians.
Well, that's
as it were.
Okay.
And as it should be.
Let's say you want the good news first or you want the bad news first. So you must, let's go with the good news first.
Yes, let's go with the good news first, which is that we are now going to be reaching out to Nigerians.
In terms of the palliatives.
You know, BVN and mobile phone.
Well, on the BVN issue, apparently somebody is listening because following when there seemed to be confusion, people had said, it's not rocket science, guys. Why hasn't the BVN been mentioned at all? Why can't we use the BVN? Well, now apparently, if there was any difficulty, that difficulty is being addressed now, and now the expression is coming from government, because that was the minister saying that they would be reaching Nigerians through the BVN. The modalities remain to be seen.
Maybe it was reluctance. I don't know what it was. we shouldn't be entering the third week of a lockdown, and that's when we're realizing that we should be using BVN. But for whatever it is worth, it's good. The reality is that there should even be a deliberate means. How many Nigerians are banked? We are less than the majority. We're less than even half.
What did they say we are? We're 200 million. They just take that round ballpark figure. 200 million, 40 million BVN, reportedly. That's 20%, right?
And so how do we now help to reshape public spending? Not when I mean public spending, I mean expendable household incomes in a way that, people who want to make purchases, who, for the sake of stimulating the economy, obviously, but people who want to expend these incomes or these meager earnings, is it earnings really? More like the stipends, being handed out. How can we, for instance, see to it that people who make purchases can make them digitally? Okay, can make them so that we reduce. Because of course, once there's money, it is only normal that people will want to spend. It's supposed to be a stimulus back into the economy. How do we make sure that this spending does not also compromise the need? If you look at the way the virus is spreading, it is alarming.
Because we've got to keep on remembering that this is all about the coronavirus, and the fact that it's yes, even as we're getting. I like the upbeat way Governor Sanwo-Olu, usually, starts off by we got good news. But the numbers are rising.
They're rising.
The numbers are rising.
And then at a point, Lagos State had the, sort of inglorious title of epicenter. But now if you look at the way Kano is going, it is looking really, really dangerous.
Kano
and we've been told.
Yeah, Kano is an interesting sort of point of conversation because it was all over the news yesterday, even into social media, that the number had spiked, ridiculously. Of course, officials, including the governor in Kano, we had him on our news last night, was sort of putting perspective to that. They say, yeah, whereas there has been a spike, it's perhaps too soon to relate it to the coronavirus. They said, but investigations are ongoing. The rate of burials of bodies in Kano has been alarming to all observers. So they're really scrambling, trying to find out what exactly has gone wrong. And I don't know what kind of investigation they're doing, but...
No, but even if you looked at when did the virus get to Kano? An official figure said we have 73 cases in Kano already.
Yeah.
That's not a joke.
Yeah, it isn't. You see, it goes back to the whole question of testing again. There have been... Experts have said that, look, the figures that we declare in Nigeria can, because we're not going to, this is not a creative art. This is very, very scientific based. You will only extrapolate figures from the surveys and the tests that you conduct. Now, if we are testing in a limited field, we can only bring figures out of that. So people are suggesting that if there was and of course it's ridiculous to think like that, but if there was a magic wand and we could increase the scope of our testing, something like much more than 100%. If we could quadruple the rate and the scope at which we are testing, perhaps the numbers might be different. And there are all sorts of problems, as you know. The other day we had the topic of the stigmatization. So people are not cooperating. In other areas, people will come forward and say, whereas at the same time we don't want somebody who just has a flu or has a cold, has a catarrh, to come and clog up the system. But it really has become very, very complex for guys who are managing this.
Yeah, and then again, I think that as for Kano, as for Ogun, as for a number of many other states, the real challenge is I think is more of a question of integrated policy approach, or our policy plan, because if you look at it critically, you will find on Koyori that the testing is important. Some persons are asymptomatic, some are symptomatic. Testing is important, but there are people who even recover without being treated.
Indeed. You know what?
So the question now comes to the issue of our capacity to deal with those that must be dealt with. Whether it is use of ventilators, whether it is the use for whatever it is what. Some states appear to have been caught off guard. Whereas there are some other states that haven't even had up to 5 cases, but you can look at, they've thrown all the arsenal at it.
Okay.
So it comes down to the question of how prepared are we as the federal government and our states to ensure that when we have cases, those cases don't become death sentences.
Handle them. The
That
system is
becomes
not
the key
overwhelmed.
question. Yes.
Okay, you know, we were speaking about Kano earlier. Let's go back to that subject matter, and we have a report from by R. Issa Ibrahim, a man in Kano.
Kano State has witnessed an alarming rise in positive cases of the coronavirus. The state has recorded 59 active cases in less than 2 weeks and a death. According to the state health authorities, 89% of the patients have no travel history and largely reside in Kano Municipal Local Government. Others live in Komboso, Tarauni, and Fage, all within Kano Metropolis. Out of the 59 active cases, 87% are males and 13% females.
There are asymptomatic cases in Kano that we might have not paid that has been transmitted. And the more we establish testing facility, the more we escalate our testing capacity, likely the more we are going to get more cases.
With the situation in Kano, the state government is appealing to the federal government to release funds to help it fight the spread of the coronavirus pandemic. Governor Abdullahi Ganduje presented this request when the Director General of Nigeria Center for Disease Control, Chike Ehekwezu, paid an assessment visit to the state.
Since it started in Kano, you look at the speed at which it's going. I think we need urgent financial assistance to Kano State. We know Lagos is big, but the economy of Lagos is much better than the economy of Kano.
On his part, Director General of the Nigeria Center for Disease Control, NCDC, Chike Ihekwezu, pledges support for the state in the fight against the spread of the coronavirus.
We have to find solutions. We cannot run away to anywhere. Secondly, we can all see the impact it will have on our economy, on our way of life. We have, as leaders, no other option but to buckle down and see how we can find solutions.
Kano has been on total lockdown, which is to initially last for 7 days. Medical professionals in Kano State are worried about the rising cases of COVID-19 in the state. For that reason, they call on the government to provide protective kits for those in the front line. They also call on the government to decentralize the state testing centers so that more suspected cases can be tested. According to them, that would help mitigate the spread of the coronavirus in the state. Ibrahim Issa, TVC News, Kano.
Indeed, our appreciation to you, Ibrahim. Indeed, we'll be speaking with Ibrahim very, very shortly via Skype. The man is actually in transit. As I was saying, all the whole TVC reporters core, they're constantly on the move trying to stay on top of this. A bit of a scramble, very much as the authorities are also scrambling to contain this situation. Well, there you have it. Yeah, the governor was making... He was saying, you actually have to know who is who. You know, nowadays everybody's wearing a mask. Everybody's wearing a mask, and you don't know who is who. But we know who the governor is, and we heard him.
Yeah. So if you asked me, I think that the first thing.
Wait a minute. I think we got Ibrahim Issa on Skype. Let's see. Yes, we did. Good morning, Ibrahim. I believe you can hear us. Good morning, Ibrahim. Okay, Ibrahim, we're going to try, again, as usual, we'll tug the wires, yank them a bit and see if it makes a difference. We'll be right with you again. Because one of the things, in fact, I would like to, Ibrahim's on ground, and social media was agog. Yeah, social media isn't hard, it's hard news, but the fact that people have a camera in their hands, you know, and they're actually recording actuality, they might not be able to put perspective to it, and they might be coming up with perhaps non-professional conclusions, but still, we do need professionals like Ibrahim to give us perspective to some of those things we're seing. Indeed, in the case of Kano, I don't know when those matches, those soccer matches were played.
The Corona Cup.
The Corona Cup, so-called.
So-called.
Again, Ibrahim will sort all of that out.
And about 30 people have been arrested for participating in the games.
Which means that it's not an ancient film.
So the reality now is this. I think that across the states, one major weakness in the strategies has been that governments have focused on building isolation centers and putting those things on the in the media, in our faces. They talk of...
Oh, one moment.
Okay.
I think maybe we have Ibrahim now. Hello again, Ibrahim. Okay, this time. Can you hear me this time, Ibrahim? Good morning.
Well, I really can't get your question very well.
Oh, okay. I haven't even asked one yet.
Of what is exactly happening where I am right now. The Almajiri from various local governments, talking about the 44 local government areas of Kano State, are going to be repatriated to their home states. Right now, today, about 667 Almajiri children will be repatriated to Jigawa State. Currently, where we are, they are being screened by health officials, and then they are going to be also disinfected before they will be taken down to the border town at Jigawa, where the Jigawa government officials would receive them and then take them to the NYSC orientation camp, where they will be on isolation. They will be screened to ensure that these children are not carrying any virus, talking about the COVID-19 or so, before they would now be taken back to their family members. The situation in Kano has been worrisome these days, especially with the rising numbers of the coronavirus pandemic. And the government is putting everything possible to ensure that the spread of the virus is curtailed. The state is currently on lockdown, and the lockdown
Okay. Ibrahim, I wonder if we have audio contact. Thank you very much for the report, but as you said, you couldn't hear us, and so you just gave us a situation report there. Can you hear us now, Ibrahim? We're not luckier yet. Well, maybe we will switch to the phones and see. I don't know. It's a bit complex because we have multiple people on various lines, and but he brought up the whole matter of the Almajiri children again, and this can actually connect with something else we were going to be looking at today, which is how well we are doing in terms of effecting the whole lockdown, meaning stay at home, don't roam the streets. It was not a matter of don't roam the streets. Please don't go out. But in the case of roaming, it's even worse. And the Almajiri children, that's a problem anyway, anyhow, because they have their life, the life they've always known, and that simply doesn't include being isolated.
First of all, I think
so it's getting them to understand this concept. It's like their whole world is being turned upside down.
They don't
have to understand.
They don't have to understand it. We simply have to enforce it. That is the issue. And I think that, broadly speaking, whatever, for advocates who want the Almajiri system reworked and reformed, this should give us an opportunity. The reality is that you cannot impose a lockdown when we're having a global health emergency of this kind, and you are and you cannot enforce a lockdown in a time like this. You have no other choice other than to do what the government is doing at the moment. I think that by and large, we are coming to the realization that there are some things that just have to be done, whether we like it or not, because circumstances have forced it upon us to get them done. One of it is to be, and it shouldn't just be the governor of Kano State. It should be that groups, vulnerable groups generally, that maybe have no shelter, perhaps don't have their own a solid means of livelihood, and you know that when they stay at home, they have no home to really stay in. So now they're being taken to an NYC camp in Jigawa State. Mm-hmm. And so across all the states, we must make it, coronavirus does not have to have come to your state, by the way, for you to take these steps. Wherever you are, when you know that the circumstances on your hand will not enable you to deal with the pandemic if it came to your state, you have to start taking those steps now.
Yeah, I'm sure all the governors
because
are aware
if you don't take it now, you'll be caught pants down.
Yeah.
This is the question, and I was saying that for a lot of states, what they basically were doing was to tell us that they had built isolation centers, that they equipped them, and we are seeing all of this on newspapers and on television. But the first thing they failed to do is that the human element that will be thrown out there on the front lines to deal with the pandemic, we are not being equipped. Now, you heard him say it in his what we call PTC, his peace to come. That last thing he said before, he signed out. he was saying that, look, that there is need to make sure that people who are on the front lines have protective equipment. The enemy in Kanu, as it has also said in many other states, have said that, doctors, listen to us. We are the enemy. If you don't have face masks and hand gloves, do not attend to any patient. Whether it is reported or not, I do not even know, but more doctors are getting infected.
Yeah,
so
that's a fact. And some medical staff are alleged to be abandoning their positions, and that's the last thing we need, because these are the soldiers in this war, this medical war that we are fighting.
No, but so how do you juxtapose that with the war on terror? When soldiers say that they have nothing to fight Boko Haram with and that they are running. So this is the thing. Because they're human beings.
Yeah.
Patients come to hospital and say, I have not traveled history, I have not been to Europe, I have not gone anywhere. I'm just coming here, to get treated. And then the doctors who are supposed to, ask all the right questions, they do their due diligence, but they still fall a victim. If we had all that we should have in place, for what it is worth, we heard about there were the kits that Jack Ma donated to Nigeria. There were also the kits that we had that the Chinese medical team that came to Nigeria that were going to bring millions of face masks. So why do we still have hospitals where doctors don't have as little as face masks to wear?
In addition to the ones that we ourselves are actually making.
Why don't we have enough to go around?
All of these are roped up in the other aspect is what are the efforts that we are actually floating to combat the situation, especially this whole one about isolation not being taken seriously. Ifunanya has a report that will include this.
The management team of the Nigerian Shippers Council acknowledges that circumstances at the seaports are quite unusual at this time. They are touring facilities to ensure strict observance to safety guidelines as it relates to containing the spread of the coronavirus pandemic. Assessing operations at the PTML terminal, the team knows that operations here are automated, thereby limiting human interface. But despite interventions geared towards ensuring seamless operations, taking delivery of goods has been low.
So we have been going around. We are now at Grimaldi, and what we have seen is impressive. It is observing all the rules. That is social distancing, it's observing sanitation, temperature taking, and you could see that there is no crowd, there is no gathering or huddling. That's what a terminal should be.
There are many agents and importers who need to go physically to the bank also to collect cash, and this is impacting on the level of deliveries in the port. And that's why, despite we've been working continuously all through this period, even during weekend and during holidays, the level of deliveries from the port has gone down. We are already equipped to provide our clients with invoicing system online. They can get their delivery order online, they can get their container refund online. So really, they need to come to the port only to take delivery of the cargo.
It is a different story at the Tinkan Island Customs Gate, the TICT, Ports and Cargo and Max Line Shipping Company. Compliance to safety guidelines is not being observed in spite of the high risk of exposure. The registrar of the Council for the Regulation of Freight Forwarding in Nigeria led the Maritime Tax team to enforce compliance, but port users attribute the poor situation to unresolved factors.
It is not a joke, it is real, and they have to try and observe it. Despite all my preaching, look at the clusters. They are still clustering. It is sad. The challenges are bound to be there, but we are also addressing them.
It is business unusual at the nation's seaports, especially with emerging challenges that have continued to cause delay in cargo delivery. But relevant port agencies are saying that they will tackle the problem to ensure seamless port transactions in the ports. Ifunanya Eze, TVC News, Lagos.
Ifunanya, she said her name complete, all the syllables. Thank you very much, Ifunanya. There is the port operations part of it, which is very important. We've actually spoken on this particular subject matter before, and how we need to clear the ports. We just need to have room to get in essential supplies. But also it includes procedures as to how to keep the ports safe too, because it's people in there. And God forbid, if people start going down, those ports, no matter, we have not reached the level of automation yet, that's going to be a challenge for us, right?
It will be, in fact, it will be a colossal challenge, because the ports are the entry point into the economy. Goods, especially essentials, and so...
And it's gotten to be a dire situation, because the last time we spoke about this, that's about a week ago, we were saying that the ports reportedly were the cargo sheds were, reportedly up to 95% full. And so how do we decongest them so that essential supplies can come in and all? It's a domino effect. If you can't offload...
No, you see, just like what I was saying earlier, you don't begin to fight COVID-19 when COVID-19 comes. A lot of countries that are able to deal with this virus are dealing with it successfully, as it were, because they had infrastructure prior to the coming of the pandemic, of the virus. You don't wake up, how else do we even express this now? You don't begin to fight the virus as soon as it comes. You should have had structures in place before now. And so we had Ebola, we've had Lassa, we've had all sorts of things. The reality now is this: if we don't do what we need to do, if we don't clear those cargo sheds, we're not hurting anybody else. We're hurting ourselves invariably. And so it behoves us, it behoves leadership. The president in his speech actually said that, look, we should even begin to think of, was it the president or one, that we should even begin to think of building health facilities, at the ports, at all the entry points, at the borders, and so on. All of these would help to integrate our response.
Yeah,
our response.
You're right. Essentially, what you're saying is the truism that it is in peacetime that we prepare for war. And because, as I said, we've spoken about this before. We've been on it. We've been on this particular situation of the ports being the way they are for at least 10 days. Where we are now with Ifunanya's report, okay, thank you, but it's not too far removed from where we were all of 10 days ago. It might be, and this is where they're getting your goat, that, why are we taking this long? Why?
The simple thing we should have done is that I do not know who is representing this aspect of things on the PTF, but it should have been part of the PTF's strategy.
Although,
And so...
I hear you, but I just want to, it's good that you bring it out, but I can't imagine that those people aren't thinking about it. Whatever their clogs are, at least they must have been thinking about
No, but things. I mean,
they must have been thinking about these things.
At the risk of being immodest, we've been here shouting BVN, 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 and yesterday, somebody said we're going to use BVN to paste, to distribute palliatives.
Okay,
so
I'm going to go on a commercial break.
Nothing away when
Sorry, I'm not shy with you. You're not a guest. I'm going on a commercial break. Stay with us, please. We'll be right back. Okay, welcome back. And talking about our ports, and in particular the seaports, how to keep them safe as well as efficient. They must be running. We had reports, this was up to 10 days ago, that there was something like between 90-95% full. How do we decongest them and keep our people safe, keep port operators safe? Now, joining us is Mr. Dijilaye Afolayan, a former Assistant Controller General of Customs. Good morning, Mr. Folayan.
Good morning.
Thank you very much for joining us. No doubt you are aware of all these efforts. let me ask you for your assessment, number one, of the seriousness, severity of the situation in terms of congestion with cargoes of the ports, and then two, efforts to make sure that they are safe for us to even move in and begin to address the problem.
Yes, thank you very much. Over the number of years, concentration of discharge of cargo has been in Lagos port. But Nigeria has been blessed with many seaports where goods can be discharged. If this ports has been put in effective use and diversified, not only concentrating on Lagos, I think we will not be in this problem. And again, we know all the attempts have been made to establish dry ports, but our roads are not good for such, because these containers, these goods will move out of port, driven to maybe to overland to where the dry ports are, and the road is congested. So with all this and bad road, non-use of other accessible ports, and the movement of trucks has been the result of this congestion. And it's not late if we direct our attention to divert and not only divert, establish and improve other accessible ports where the care can be made. Especially if the petroleum depots along our ports are relocated, I think we shall have relief.
Okay.
On this.
Okay. Well, what you've told us so far really is pointing to the fact that we can't use the alternatives. Things which might have done in the past have not been done, and this, further complicates what we have now. But let me ask you, how big an emergency do you think it is? Because you said dry ports are not going to be feasible. It's unfortunate that we've concentrated far too much on the Lagos ports. Now, with what it is, with the figures rising, how much of a danger do you think that constitutes? And how well do you think we can cut this problem of making it safe? Because you bring people in there to try to address the issue. You don't want at the same time to be exposing them to risks of possibly catching the COVID-19 virus.
Pardon me. We'll come up again.
Okay, sir. How do we make sure it'll be safe for those that need to come into the ports in Lagos, for example, in the face of COVID-19 now?
Well, we find ourselves in this problem. This COVID-19 has opened our eyes to all the shortcomings and for the fact that we are not prepared for this type of situation. Now, the only thing can be done is let government start diverting most of these ships to Warri, Port Harcourt, and other Calabar ports where they can discharge, so that you discongest the human movement around Calabar port. And that will be effective to carry out the distance and keep safe of this situation of COVID-19.
I see, sir. Well, I want to thank you very much, for coming on and giving and sharing your perspective on this serious matter before us. Thank you very much, Mr. J.J. Laye Afolayan, former
thank you very much.
Assistant Controller General of Customs, and he should know. Well, he's pointing out, largely very much as you were saying, that, look, some of the things that we might have considered doing, but hey, we don't want to enter the spilt milk syndrome.
So what we should do is that
we now have a problem on our hands that we've got to address. Unless people are going to begin from today to, this whole idea of moving out, diversifying our port usage, even if that were to start today,
we can't.
It's not going to achieve
It's not feasible within the.
So the problem we have is the Lagos one don't nearly spoil. How do we move in and still be safe? I think that's the biggest concern.
Exactly. So the simple thing we can do, in fact, I have read some Nigerian economists who say that we can't shut the economy down the way we have already done it. So can we isolate some persons who can help, moving these things away from their perhaps a temporary holding, for as long as it will give us room to deal with and to handle essential services. The reality is that in the end, how well we deal with COVID-19 it's going to be justified in the outcome, and the outcome can either be good or be bad. It's going to be on us as Nigerians. What we need now is leadership, solid leadership, to look at the situation, look at the cost-benefit ratio, and come up with a solution that takes in the least that can be implemented at the least cost, but with the highest benefit. That is the best we could do. The fact is that across the states, from Lagos to Calabar to I think Cocoa in Delta, you have the port. Of course, the Port Harcourt port is as good as no longer functioning. But even the minimal thing that those ports could have done for us at the moment is inhibited by a number of factors. And that was why I think at a point it wasn't proposed that we should incentivize the use of those other ports. But the fact is that when you're fighting a war, basically, when you're fighting a public health war, there is only so much that there is only so little that you can actually do. And so within the given, perhaps we could get people who would be good enough to move those things to temporary holding, and then think of how we can begin to, and so with that ease, think of how we can accommodate more essential, things coming in.
Now, as I was saying before, the experts, that's what I have to call them in the presidential task force. Those they're knowledgeable. They probably are seeing. They have a.
But not infallible. You and I
they're not
we have been shouting
BVN.
Yesterday it resonated and someone said BVN.
Yes. Yeah, I wasn't suggesting that, but look, I'm just guessing that at the very least, they must have a bird's eye view. You'll be surprised when you hear people's challenges and what the blockages are, what the challenges are, what the problems are. But it doesn't hurt at all that we are reiterating these things that seem like not to be rocket science. You just mentioned BVN. We started that from day one. Everybody from home was calling us. Maybe, in fact, we'll open the...
No, look,
and we'll open the phones now and try...
Again, because it took
I
protests.
don't know what's going on in there, but...
It took protests.
Yes.
For people to say, you couldn't possibly be adding demurrage on what we've imported at a time when even when the economy had been shut.
Yes.
So it takes look, if even if somebody is thinking about it,
okay,
and is not talking about it, we owe it,
okay,
in public interest,
indeed,
to highlight it,
indeed.
Or we possibly couldn't afford to be quiet about some of these things. It doesn't matter whether someone is thinking about it or not. We have to keep highlighting it until we see a solution, because we are part and parcel of the process, and that's why we would say that, look, out of COVID-19, one of the big pluses that should come out of it should be that we are now thinking of expanding or broadening the port base, that Lagos should not be the only place where goods come in.
Okay.
How can we begin to think of that?
Now, I think we're going to be...
Short-term, medium-term, and long-term solutions.
Let's try and take some calls now, and I don't know, so that the thing doesn't go all over the place. We want to try and look at what efforts towards maintaining the isolation and social distancing. I think if we were to try and keep it in that focus for our callers, then we wouldn't be all over the place. Good morning, Reverend Dominic.
Good morning, Uncle Yori.
Thank you very much, sir, for coming in.
Yori, quickly, please, confirm this news for me. That this news that coming from Kano, that over 150 people have died in Kano. We don't know the reason. Is it right or wrong?
We've all been hearing stuff. The only thing I can tell you is probably what you know yourself, which is that, yes, there has been a surge in Kano, but the authorities there are considering what exactly is the reason for it. And we have to wait for them to come out. They say it might be too early in the day to attribute it all to COVID-19. They have been mentioning other instances, but what is not in any doubt is that there has been a phenomenal rise, a spike, if you want, in the number of burials. Yes.
Tell me now.
Yes.
Okay, please, Yori, the number of COVID-19 we have in Nigeria is not alarming. I say this because of this reason. Ghana, as a nation, about less than 60 million people, had tested over 40 to 50,000. I can't see again, my power is gone, but can you hear me? That is a small nation has tested 40, 15,000 people. If we have tested up to 40 to 50,000, we could get clearly the picture of what we are fighting. As long as we are doing 1,500, the result we have is as a result of the testing we are doing. The only way to put this thing, and we have lost it now, for this about 4 or 5 weeks, is to have a massive testing. So we can get the picture of the monster we are fighting.
All right.
As long as we are testing 1,000, 2,000, 3,000, 20, 30, 40, 50, it is not bad by the capacity of testing. It is not a broad testing. Why can't you test up to 100,000 in a nation like Nigeria?
Thank you very much, Reverend Dominic. I appreciate the point, and let's make room for other callers. The point he makes, we've made, and a lot of people are making, that look, they are fearful that the numbers we're getting is because of the scope that we are able to, cover at the moment.
But again, we have to sound, you see, coronavirus is not a death sentence. We need to make it clear that.
Yeah, but
some persons don't even...
With due respect, Cyril, that's another point that you're making. But the point that he is making, that we need to know, because transmission here, we've entered into community transmission. That's why it's crucial to know exactly the lie of the ground. And I think the fact is that the testing scope is as limited as it is because of the resources at our disposal. And that's what he was bemoaning, that if we could extend it, quadruple our scope, take our scopes 10 times beyond where it is, maybe we'll begin to get numbers that are a bit more reflective, because as you and I know, research is more effective, isn't it, when you can widen the scope of your survey. Then you can begin to depend, but you do a survey, so to speak. It's maybe not the best analogy, but you do a survey on a very limited, maybe 10 people. You can't begin to trust that, and then try to extrapolate that to 200 million. So the point Reverend Dominic is making, it's well taken, it's also well noted, but it's also frustrating. These tests are not exactly expensive. We've been told how difficult they can be because these symptoms of COVID-19, these are indistinguishable at a certain level to that of malaria, which a lot of people, quote unquote, cheek.
So, I mean, it's difficult to place the argument in one place. Like you rightly said, it's frustrating. You hear of states that are on lockdown. Commuters are applying. People are out looking for daily bread.
Yeah, that's because of our situation.
How do we...
that's because of the situation we have.
What's the...
Look, I heard someone say the Kekemarua something, where they would be allowed, they would not be allowed to have more than one passenger, where they would be allowed. So you see, you understand why it is being said like that, but then you begin to look at the practicability of these whole matters. And then, as you rightly said, there are lockdowns in place. There are even official openings. There are even official openings. Say, look, Cyril, you know what the problem is. In the UK, and it can be annoying for people to be referring to the UK, the US. In the UK, there are pictures online of the government, the authorities. Don't come. Don't try to go out. We'll bring stuff to you. People are leaving stuff at people's doors, and say, look, I understand, if there's anything else that we should have included, let us know, we'll come back. Now, we are nowhere in that kind of an orbit at all. But somebody has come on the phone. I understand I have someone. Good morning, Port Harcourt. Hello, sir.
Hello.
Yeah, good morning.
Good morning.
Yes, please go ahead.
I was not hearing you, so I don't know what were you saying?
We can hear you now.
Yes, but what do you want me to say? You say I should go ahead. What am I responding to? Hello?
We thought of this as a call-in time for our viewers, unless I'm getting my lines crossed here. I thought that was a viewer and a caller who wanted to contribute something very much like Reverend Dominic had done and all other people do. But the gentleman in Port Harcourt, I don't know, maybe was that a resource person? Mazi Okorafor, good morning.
Good morning, Salori.
Good morning, Mazi. Tell us what...
You see, the problem we are facing today is that when this issue of COVID-19 started, 70% of Nigerians did not believe that such thing exists, even up to today. Because if you see what your research man have been saying and the rest, you see that it's boiled down to the same thing. Now the question is this: even up to today, the communities we have today, they don't even believe. Look, if you go to our area today, people are still going to the farm, people are still doing what they are doing. Now you ask, he said that, do you hear what he said? A big man sickness. Now, what do you mean by big man sickness? Look at what the government are saying and what they're supposed to do. We don't care. Now, what I'm trying to put across to the government is this, because since we have to be buying people now, no, that is the issue. This issue of bribery and corruption. Let's not be buying them. All this money, those people that they sent to prison yard, indicate that they carry state money or government money and they were sent to prison. I'll just tell the president, as a matter of business, just give them state pardon. Tell them to bring back the money, at least half of the money. Let them bring it to the government.
Mazi, you are aware that the president has written to the CJN to please expedite all these cases with a view to decongesting the prisons.
That was what we had. Is it yesterday or day before yesterday?
Yes.
So I don't know whether those ones are involved. I don't know whether they are suspicious, because if you check well, you see what happened in South Africa. In a prison, one of those prisons, the correctional center, over 90 people were contacted it, 90 in the prison yard. Now you ask yourself, Nigerian case, we pray it will not happen like that. But if the president have just said something, I agree, I heard about it now. But the question now, what is the speed? Now, because 80% or 90% of Nigeria, what we're talking about, palliative. And there are three major types of palliatives which the government are not looking into it. Every day we talk. At the end of everything is that this issue of electricity 247 is not there. And this issue of water is not there. The pipeline water we are talking about is not there. It's only people that have what they call personal water that can get. And it doesn't even go. Now, ask yourself, do the states themselves make provision for this and all these tankers we have? Can the state use it at least and bring water and supply to it so that we have these 247? It's not there. And the palliative you are talking about, what is it? It's not there.
Okay.
And even if it's there now, you see the gra on top of it. It's too much. That is why you see everybody. Now you ask yourself now, by next week now, the president will now extend. I don't know whether to extend. With the look of it, he has to extend. Because there's no solution about it.
Okay.
Now if the president extend, what is the issue of that palliative?
Thank you very much, Mazi. Thank you, Mazi. Well, you know, all those guys in government, you know, and all the guys who have a job, a very important job to do, they need to be listening to programs like this, because one would have wished for them, for us to be hearing calls of appreciation of what is being done and encouragement to other areas. But this sort of gives something of an indication of, in spite of all that they are doing, the commentary is that there's a lot more that needs to be done still. You know, one doesn't want to sound as if one is unappreciative of all the efforts. We hear that people are working around the clock. But this is like a reality check in that people are calling in simple things. I don't know. You made the point. You started off with the whole line, the paradigm of it is in peacetime that we prepare for war. Mazi Okorafor, there's no time he will call in and will not call attention to water, the most common, next to air, the most common. Even if you don't have money to buy sanitizers, can you wash your hands, please, as many times as possible every day? Sounds like the simplest of things. But again, this is not a problem. This provision of water to the citizenry is not a problem that can be sorted out overnight.
People are still buying water on that.
So, Anthony in Ringham, good morning, sir.
Good morning, sir.
Thank you for calling in. Go ahead, please.
Thank you very much. You see, what I want to say is this. It is high time the federal government, starting from the federal government to the local level, to begin to tell Nigeria the truth. What is actually happening is this. For a very long time, the government has not been telling people the truth. And it is now that, even now, people find it difficult to believe what the government are saying. I think it is high time the government begin now to change their mindset, change everything, and begin to tell the Nigeria the truth, so that by the time
what particular part, Anthony? What is the part that vexes you?
I'm telling you, just like
what truth do you want to hear?
Someone in your studio said. In fact, many people, even up to today, some people don't really believe that COVID-19 exists.
Okay.
Even we are living today, a lot of people don't really believe that COVID-19 exists.
But that's not government's fault now.
This is the way people are making. The government wants to make money. Some people want to make money out of it, and I think it is the right time the government begin to tell people the real truth. Whatever is on ground.
Okay, Anthony.
Come out and say the real truth.
Anthony, I didn't understand you. What is the truth that government is not telling us? An example.
An example one. When insurgency attack our soldiers, 10 people will be killed, and government will come out and tell us it is only one person.
Okay. All right.
That's the simple truth.
Okay.
And so many of things like that. This is one example.
Okay. All right. All right. Thank you very much. Because he then linked that to so many people don't believe in COVID-19. So I was going to say that's hardly government's fault. In fact, on the contrary, government wants people to be aware of the nature of the enemy. But I thought he might have said that part of the truth is extending it as much as possible to every last nook and cranny. But thank you very much for calling in, Anthony. The way his vexation went was that government has not been telling us the truth. Yeah, people can call in and we will take what you take. Yeah, we're very happy to bring in Ada from Jos. Good morning, Ada.
Good morning, Yuri.
Good morning, ma'am.
Your colleague there.
Yes, Cyril. Good morning.
This COVID-19 thing is really unfortunate. Hello?
We can hear you.
Yes, okay. You know what is happening in Kanu? I said it in different platforms. I couldn't get through to your own platform. I'm not really surprised at what is happening in Kanu. I was so scared because of their large population, ignorance, poverty. So I think the governor should have been proactive. It's unfortunate he decided to go that way, the way he went. And it will take a miracle to save lives in Kano. It's really unfortunate. I'm not sounding like an alarmist, but I hope Kano doesn't become an epicenter in Africa. It's really unfortunate. Let the 36 governors, that is the state governors, synergize. Let them have a common lockdown. I think they want to have a meeting today,
Yeah.
So it will be effective. Let them lock out.
Okay, Ada, thank you very much for calling in. I'm afraid I've got to interrupt you. I've run out of time. Really do appreciate getting to hear from you, Ada, in just there. How I wish we would have gotten our own Ibrahim Issa back, because I wanted to ask him a bit more about Kano, but it is what it is, and we will have another opportunity. I want to thank you all that were able to make it in, and then again to also acknowledge our reporters who are also like our troops on the on the front line out there. So that's been our program today. Please join us tomorrow. On behalf of Cyril, I am Yori Folarin saying bye bye for now.